Hi, I'm Ashley Randall and I will be doing an IV insertion and removal. First, you would make sure you have all your equipment needed. You will have gauze, tape, alcohol wipes, adhesives, tourniquet, gloves, a syringe, and your tubing. So first you would introduce yourself to the patient and tell them what you are doing. You would ask them their name and date of birth and compare it to their name band. You would provide patient privacy and do hand hygiene. You will go ahead and put on your gloves, and while you're doing everything, you can explain it to the patient. If you can get your gloves on. Okay, so while you're waiting, you can go ahead, or once you have your gloves on, go ahead and tie your tourniquet and feel for where you want to stick your needle and what vein you want to put it in, and you will bounce your finger on it. Go ahead and get alcohol wipe and clean vigorously. And you will not blow on it or fan it in any way, because that just defeats the purpose of cleaning it. So as that's drying, you can ensure that you have all your equipment, like your gauze, your tape is all ripped up, you have your adhesives, and you have all your equipment. So once that's dry, you can go ahead and insert your needle, and you can pull the skin tight to make it easier to get to the vein. And once you have flashback, you know you're actually in the vein, so you will lower your angle and go about halfway through, and then you will proceed forward with just the catheter and pull the needle out and quickly attach the tubing. And you can pull back to check for flashback, and that will ensure that you are inside the arm or the vein. And you will press forward to flush the IV, and you will go ahead and do one piece of tape over the catheter. And now is when you would also unattach the flush, and you can also do a chevron taping, which just go under and tape across, and also make sure you pull your tourniquet. And now is when you would use the latex free or latex adhesive dressing, and it's clear, so I'm not going to prevent waste of supplies, but you would open it up and put it on there and initial and date it and say what gauge needle it is, and then you would document how they tolerated, and you would also document what gauge needle you inserted. So you would also remove your gloves, but I will now be removing the needle, so you'll pull the tape towards the catheter. Don't pull on it or you'll hurt the patient. And then you'll get your gauze and hold pressure while you remove, and you will hold it there anywhere from 1 to 2 minutes until you feel like the bleeding is finished, and then you can also tape it on there. And then you would also inspect the catheter to make sure there's no pieces broken off, and if there was, you would document so, and that is it.